Over 60 and your shoulder won't let you sleep, reach, or dress without a wince? In the next few minutes, I'll show you safe, doctor-approved ways to fix shoulder pain at home, starting today. Shoulder pain after 60 is usually about irritated tendons, stiff joints, or a frozen shoulder, not just aging. The good news: gentle mobility, smart strengthening, and daily habits can reduce pain and bring motion back. Before you begin any exercise program, it is essential to recognize the signs that require medical attention. If your shoulder pain comes after a sudden injury, if there is a visible deformity, or if you experience unexplained fever, chest pain, numbness, or severe pain that keeps you awake at night, you should seek medical care immediately. These are warning signs that the problem may be more serious than a simple strain or stiffness. For adults over the age of 60, shoulder pain often stems from conditions such as rotator cuff irritation or impingement, frozen shoulder, or arthritis. These issues are common and can usually be improved with the right approach at home, but they should not be confused with emergencies. Starting smart means knowing when to treat shoulder pain with home strategies and when to let a clinician evaluate your condition before you begin exercising. One of the most important steps in reducing shoulder pain is restoring gentle movement every single day. 2 simple exercises are extremely effective: pendulum swings and assisted elevation. To perform a pendulum swing, lean forward with your unaffected arm resting on a table or chair for support. Let the painful arm hang down and gently move it in small circles, front to back and side to side, like a slow, relaxed pendulum. For assisted elevation, you can use a stick, cane, or even an overdoor pulley. Hold the stick with both hands and allow your stronger arm to guide the weaker one upward, moving within your comfortable range. This helps restore mobility without forcing the joint. Remember the acceptable pain rule. Mild to moderate discomfort is fine, but stop immediately if the pain becomes sharp. If your shoulder remains sore for more than 20 to 30 minutes afterward, ease back on the intensity the next time. Consistency with gentle mobility is what gradually reduces stiffness. Many shoulder problems are made worse by poor posture. Over time, slouching forward allows the shoulder blades to roll inward, which narrows the space for the rotator cuff tendons and increases impingement.
If you
A
ask me
simple
to give you
fix
just
is
one
the scapular
exercise to
set
train your triceps for the
exercise.
best.
Stand tall with your shoulders relaxed. Imagine gently sliding your shoulder blades down and back toward your spine, as though you are trying to place them into your back pockets. Hold this position for 20 to 30 seconds and repeat it 5 times. This small correction creates more room for your tendons to glide smoothly and reduces pinching at the top of the shoulder. Practicing posture resets throughout the day, while standing, sitting, or even walking helps relieve pressure and trains your body to support natural shoulder mechanics. When your shoulder is painful, traditional strengthening exercises can sometimes make symptoms worse. That is why isometric exercises are the safest first step. Isometrics allow you to strengthen muscles without moving the joint, which means there is less chance of irritating the tissues. To perform an isometric external rotation, stand sideways against a wall with your elbow bent to 90 degrees and tucked at your side. Press the back of your hand gently into the wall without letting your arm move. Hold for 5 to 10 seconds, then relax. For an isometric internal rotation, turn so your palm presses into the wall in the opposite direction, again holding for 5 to 10 seconds. Finally, for the deltoid set, Stand facing the wall and press your fist forward into it without letting your arm move. Repeat each exercise 5 to 10 times, holding each push for 5 to 10 seconds. These gentle contractions wake up the rotator cuff and deltoid muscles, restoring stability to the shoulder. Once you can do these without pain the following day, you can safely progress to light resistance bands. This gradual buildup prevents re-injury and supports long-term recovery. When shoulder pain flares up suddenly, knowing whether to use ice or heat can make a big difference. Ice is best for irritation or swelling. Applying a cold pack for 15 to 20 minutes can calm down inflammation and reduce sharp pain. This works especially well after a new strain or if you notice your shoulder feels hot and irritated. On the other hand, heat is more helpful for long-standing stiffness or aching joints. A warm compress or heating pad can relax tight muscles, improve blood flow, and loosen the shoulder before performing mobility or strengthening exercises. The key is safety. Never place ice or heat directly on the skin. Always use a cloth as a barrier, and check your skin regularly to avoid burns or frostbite, especially if you have reduced sensation in your arm. Shoulder pain often feels worse at night, especially when you are trying to find a comfortable sleeping position. One of the easiest adjustments is to avoid lying on the injured side. Instead, lie on the opposite side with your sore shoulder facing upward. Place a pillow between your arms to support the painful side so it does not hang forward and pull on the joint. If you prefer to sleep on your back, tuck a pillow under your affected arm to keep it slightly elevated and in the middle of your body. This gentle support reduces strain on the shoulder tissues and helps prevent painful rolling during sleep. Making these small changes can often calm night pain and improve the quality of your rest without the need for medication. Recovery from shoulder pain takes time, and it is important to remain consistent. Aim to stay active and perform daily exercises for at least 6 to 8 weeks. Most people notice improvement gradually rather than immediately, so patience and persistence are key. For short-term relief, topical anti-inflammatory gels such as diclofenac can be useful. These treatments are often safer for older adults than taking pain medication by mouth, since they act locally on the joint with fewer side effects. Along with exercise, they can make it easier to stay consistent with movement. Remember, if the pain gets worse, if you are unable to lift your arm, or if daily activities become impossible, you should consult a physiotherapist or clinician. Self-care strategies are highly effective for many, but professional guidance is sometimes needed to make sure you are on the right path to healing. If today's plan helped, save this video and share it with someone who needs shoulder relief. Subscribe for more age-smart fixes that keep you moving.